Orthopedic surgery experts initiated this study to determine non-inferiority of MagnetOs granules when compared to Autograft. This was a prospective, randomized, multi-center, intra-patient controlled trial. By using an intra-patient control, the principal investigators were able to limit the effect of patient-specific factors on the results of the trial. These results are not yet statistically analyzed. Additionally, interbody fusion data, patient-reported outcome measures, and adverse events have not yet been collected or reported, but will be included in the final analysis. This study found favorable fusion outcomes for MagnetOs granules used as a standalone bone graft substitute when compared to the gold standard of Autograft. For interim results of the first 50 patients, please see the white paper. This study compared MagnetOs granules to the gold standard of autograft bone in adult patients undergoing posterolateral spinal fusion from T10 to S2. Each patient was randomly assigned one side for MagnetOs granules and the other side for autograft bone. The MagnetOs granules were used standalone and were implanted without autograft or bone marrow aspirate. The autograft contained local bone mixed with at least 50% of iliac crest bone. 10 cc of bone graft were placed on each side per level for both MagnetOs granules and autograft. Fusion outcomes were measured radiographically postoperatively with less than 1 mm fine-cut computed tomography or CT scans, which were read by 2 independent spine surgeons blinded to the randomization. Assessment of fusion was scored in the coronal, sagittal, and axial planes. Clinical outcomes were measured via Oswestry Disability Index, or ODI scores, at 6 weeks, 12 weeks, and 1 year. Radiographic fusion was determined by 2 independent spine surgeons, reading fine-cut, less than 1 mm CT scans. Discrepancies were resolved by a panel discussion. This study evaluated 91 patients and 128 levels for posterolateral spinal fusion. In the 128 levels that were analysed after 1 year, a fusion rate of 79% was observed with MagnetOs, compared to a 47% fusion rate with Autograft, as evaluated by independent spine surgeons using fine-cut CT scans. Notably, 19% of the patients in this study were current smokers, and 35% of the subjects were ex-smokers, a population which is more difficult to fuse based on recent literature. This case presents a 52-year-old female with a diagnosis of spinal deformity. The patient underwent an L3 to L4 posterolateral lumbar fusion, with MagnetOs granules on the right and autograft on the left. The PLF was combined with the posterior lumbar interbody fusion. This case demonstrates fusion in a 60-year-old male who underwent a 2-level posterolateral lumbar fusion from L3 to L5 for a diagnosis of spinal deformity. He had MagnetOs granules placed on the right and autograft placed on the left. After 1 year, CT scans determined that both the MagnetOs granules and autograft sides were solidly fused at both levels. This Level 1 data from a prospective, multi-center, intra-patient randomized controlled trial is the first to be released on the performance of MagnetOs in posterolateral fusions. Further statistical analysis and peer review are forthcoming.